Right, welcome along. I am chatting with Dr. Susanna Unsworth today, and we're going to be talking about irregular periods. Susie, do you want to just tell us a bit about what you do and your role in the menopause world?
Yeah, sure. So thanks for inviting me to come and talk to you today, Emily. So my name is Dr. Susanna Unsworth. So I am a menopause specialist. I'm registered with the British Menopause Society. I come from a background of general practice originally. So I have done a lot of gynecology and women's health in general. So I do know lots about women's health, not just to do with menopause, but menopause is an area that I'm particularly interested in. And I also work now more actually in the breast clinic at the hospital, seeing women pre and post breast cancer. And actually, quite a few of those women will tend to have other gynecological and women's health issues along with their breast cancer. So I often deal with lots of those problems as well. So yeah,
Awesome.
problematic bleeding is quite a common issue that I've dealt with
Yes.
lots.
So, yeah, so this month we're looking at irregular periods, which obviously anybody in perimenopause knows that that is one of those joyous things that we deal with. Um, can you give us kind of an overview as to A, kind of how our periods might change, but also B, kind of why it's happening?
Yeah, sure. So um, in premenopausal women, the vast majority of women will have a nice regular cycle if they're ovulating normally. It can range in length, so anywhere from kind of 3 to 5 weeks is sort of fairly normal, but it's normally a sort of regular pattern. What tends to happen as you start to approach perimenopausal phase is that the hormones start to change and they become quite fluctuant, and that nice cyclical pattern becomes a little bit disordered. And so this then has an impact on what happens with your bleeding pattern. And sadly, it's not usually a quite straightforward, oh, they'll get more spaced out and then they'll suddenly stop. It tends to be no one ever follows the textbook, sadly. So what can often happen is women might notice that their periods can get a bit closer together, and then they sometimes will get a bit further apart, and then over time they probably do gradually get further apart and stop. But like I said, it's very uncommon for women to follow a nice textbook like that. So it really is quite variable. And I hear lots of different stories of bleeding patterns. And I guess the thing for me to be able to try and identify is when a bleeding pattern represents something more concerning rather than just the natural changes that we expect to take place around the perimenopause. And it's really due to the sort of hormonal changes and whether or not the hormones are sort of triggering ovulation or not.
Okay, so um, as you well know, I always encourage people to track everything. So let's say somebody has been tracking their cycle and they notice 1 month that they haven't ovulated and then they get a bleed. What's going on if we don't ovulate but we still get a bleed?
So really, it's the only slight difference is that you haven't released an egg when you're ovulating. So when you don't ovulate, obviously you don't release an egg, but the lining of the womb can still be affected to a certain amount. And what a period essentially is the lining of your womb, so the endometrium builds up in order to receive an egg that's been fertilized. That's kind of what the natural purpose of it is. And then if a fertilized egg does not implant itself, then that lining is shed away. So as you approach perimenopause, you might have cycles where you don't actually fully release an egg, but you can still have enough hormone for the lining to have built up, and then you get this kind of shedding away as you would do with any other normal cycle. So sometimes there is a little bit of there's not always a perfect pattern, particularly as you start to approach perimenopause. So
Yeah.
it's not unusual to notice bleeding even when you haven't necessarily fully sort of ovulated in that cycle.
Yeah. And a lot of women complain of much heavier periods as they
Uh,
come into perimenopause, you know, really nasty flooding and huge clots and things like that. Is that again the lining being shed but with more gusto?
Yeah, I mean, I don't think we know exactly why women's periods tend to get much heavier around perimenopause. There's lots of different reasons why periods can get heavier. It is most likely due to these kind of slightly disordered hormonal patterns now that women are experiencing around that time. The only thing I would say is if a woman's periods do suddenly get very heavy, having not really been heavy before, and it's really impacting on their day-to-day life. So women, like you mentioned, women can often talk about flooding, passing massive clots, leaking through tampons and having to wear super maxi pads and still having problems. I think if you're experiencing bleeding to that extent, it probably does require a little bit of further investigation. So I wouldn't want to just put that down to perimenopause if it's at that level. It could well be that it is because of the perimenopause, and that might be the only issue, but there can sometimes be other issues going on. One of the classic things is fibroids, which are kind of muscle growths that occur in the wall of the womb, and they can often cause much heavier periods. So there are often potentially other things that can be contributing to that. So if it's a level that's really impacting on your sort of quality of life, then it probably does require you to speak to your doctor about it, partly because there are actually quite a lot of things that can be done to help with bleeding like that. You don't just have to put up with it. Women especially actually often put up with their health problems because they think, it's just my period. Periods shouldn't be like that. So if your periods are to the point where they're really impacting your life, then I would always encourage you to speak to your doctor about it. Doesn't mean there's something wrong, but there might be something that they can do to help.
Yeah. So then moving on to HRT, which a lot of women at this stage want to start using. There is sometimes, shall we say, a general belief out there that you can only start taking HRT when your periods are finished. But do you want to just talk us through the very sort of simplistic options that people have while they still have periods?
Yeah, sure. So I hear that a lot, and I hear women being declined HRT because they haven't stopped their periods. And it really saddens me because that has nothing to do with whether or not you can have HRT. There is HRT that is designed specifically for women who are still having regular periods. So I never understand why women are told that. What absence of your periods is by definition what menopause is. So by definition, if you're in your perimenopause, then it's likely that you are still going to be having some sort of period, unless you've had a hysterectomy for some reason, but you still have your ovaries. You can still experience a perimenopause in that situation without obviously having any bleeding. So there are definite options for using HRT even when you're still having a cycle. Traditionally, what we would have done in women who are still having periods is we would give them what we call a sequential or a cyclical form of HRT. So that essentially kind of mimics the cycle, and it encourages a bleed once a month, and it tends to sort of control that bleeding pattern and regulates it a little bit. And then traditionally, women who were post-menopause, whose periods have stopped, we would give them what we call a continuous form of HRT. And some women might call that a no bleed form of HRT. I don't tend to like using that term because it's a bit confusing, I think, really. But it's a form where it doesn't encourage any bleeding. So that is kind of the traditional way of using HRT. And then obviously there's lots of different ways in which we can deliver that type of HRT. But actually moving with the times a little bit, we don't always have to put women who are having periods on a cyclical form of HRT. We can try them with the continuous form. The slight downside of doing that is I find that those women might tend to bleed a little bit irregularly, rather than in the sort of cyclical HRT, which gives you generally a nice regular bleed. And then that we get into slight tricky ground when women start to bleed irregularly with HRT, because we then think, we have to then start thinking, what's the reason for that? Is it just because of the HRT, or is there some other problem going on? So it's on the whole, probably if you're still having periods, you probably go on to initially a type of HRT that continues to make you bleed once a month. If you're not having periods, then you'd go on to a form where you don't bleed. In a nutshell.
So, yeah. So then there's presumably that kind of grey area where you've been on a sequential HRT for however long, and so you're still getting the bleed because of the HRT. How do you then know that you've got to menopause, if that makes sense?
So that's quite tricky. So there's not an exact answer for that. But also we kind of feel that it's kind of a bit of information that you don't necessarily really need to know the answer to. You know, if you're in your perimenopause, then and when you're using HRT, then you're using it to manage your symptoms, and as long as it's controlling your symptoms, then you don't really need to get too concerned about whether naturally have my period stopped or not. The only time it may become an issue is if you're wanting to consider contraception options, because that becomes a factor when we decide about how long contraception needs to be used. So that's a slightly more complicated issue, which is probably a bit beyond what we're discussing today. But for most women, it doesn't matter hugely. What the sort of guidance really is, when I guess what we're thinking about was, when should we change someone from using a cyclical form or a sequential form into a continuous form? And we can really change them at any point if they wanted to try it and to see if they don't bleed with it. If they're quite keen on the idea of having no periods, brilliant, we can give it a try. There is guidance, however, that we don't like to keep women on the sequential cyclical forms for too long, actually, because there is a slight potential that can cause some changes in the womb lining if women are kept on that type of HRT for too long. And ideally, we don't like women to stay on it for more than about 5 years. So if women start it in their kind of early to mid 40s, I'd suggest a maximum of 5 years on that type of HRT, and then look at changing it to something continuous. If they're approaching the age at which we'd naturally expect menopause to happen, so maybe about 51, something like that, I often would then at that point say to some women, you know, it's probably worth us trying you on a continuous form now and just seeing what happens. If we find that they start bleeding really irregularly, then sometimes we might just change them back to the cyclical form for a little bit longer, maybe another 6 months, and then try it again. It's really tricky. Sadly, there's not an easy sort of test to do to say, oh yeah, your periods will have stopped because we've done this test. There are obviously hormone levels that you can check, but as we've probably discussed in other things on this forum, that hormone levels are so fluctuant during this time that it's actually really quite difficult to interpret. So it's not really helpful. So I wouldn't recommend having any sort of tests. So one thing I haven't touched on with this is the role of the Mirena coil. So I don't know whether...
No, carry on. Yes, absolutely.
So obviously I just spoke before about the two basic types of HRT, being the sort of the cyclical form and the continuous form. The one bonus that if you're premenopausal and you're still having periods is if you're keen to have your periods stopped, which for me, I'm sure that's what a lot of women would like, although some women do quite like having a cycle once a month. One option to always think about is using the Mirena coil as a potential way of delivering the progestogen part of the HRT. So in women that are pre or perimenopausal, they're still having periods. If we were to use the Mirena to deliver their progestogen, that has a good chance of stopping their periods, and then we can just use estrogen on top of that. So I always encourage women to at least think about that, because I think it's a really good way of actually, well, it gives you quite a few options, quite a few benefits, should I say. It helps with bleeding, and particularly if you're someone who's struggling a bit with heavier periods. It can be used for 5 years for HRT, and also it offers you that additional contraception, so you've got that element of it covered as well. So I always think it's a definite option for women to consider. So sorry,
There's one other thing I was going to ask, which is, let's say somebody has been having their natural periods, so they've not gone down the HRT route, they're not doing anything that has changed that, and they've gone 12 months clear, so everybody's happy, they're through perimenopause, they've got to menopause, life is happy, and then they bleed. What happens then?
So that is what we would call, in sort of a medical setting, a postmenopausal bleed. So if you're menopausal age, you've gone over 12 months without a period, we would classify you as then being postmenopausal. And any bleeding that occurs after the menopause really does need to be investigated. So if you have any sort of bleeding down below postmenopausal, I would always encourage you to speak to your doctor about it. It's one of the criteria that we can refer people to a rapid access clinic at the hospital, where they will often have an ultrasound scan of their womb to check what's happening with their womb lining, and if there's any suggestion that it's thicker than it should be, they will often be given the option of potentially maybe having a hysteroscopy, which is where they look inside the womb with a camera, or where they may take a biopsy of the lining of the womb in a clinic setting. It varies a little bit depending on certain factors. But yeah, any bleeding that occurs after menopause, I would always encourage you to speak to your doctor because it does need to be checked out.
Yeah. So just to kind of summarize what we've covered, periods will get irregular, and that's okay. That's normal. If they are affecting your quality of life, speak to your doctor.
Yeah,
you can go on HRT while you still have periods. And if you are postmenopausal and you get a bleed, please get it checked out.
Yeah, I think that's a really good summary. I'd probably just add two other things to that. Irregular bleeding is fine. What we get more anxious about is if you have any bleeding in between your cycles. So if you have quite irregular cycles, but you notice sort of spotting in between, that is another reason that I would always encourage you to get that just checked out with your doctor. And then the other thing is if you notice any bleeding after sex, that is another indicator to have it checked out. The vast majority of the time, it's not going to be anything to worry about. There's lots of different reasons why it can happen, but there are sadly some concerning reasons why it can happen. So related to the cervix, related to the womb lining. So those sort of bleeding patterns at any time, I would encourage women to get them checked out with their doctor as well.
Thank you so much, Susie.
No problem.